name's Rebecca Garrison. I'm a PA with Alpine Orthopedics. I'm here today with Ashley, and we're going over some of the important stretches after your shoulder surgery. So we have Melissa, our physical therapist here, who's going to take us through some internal rotation stretches.
So internal rotation stretching is really critical and important after your shoulder surgery. We also have a video that is related to external rotation. These are internal rotation. So when you think about internal rotation, it's anytime your hand is moving toward the center or inward in your body. So focusing on that palm towards your belly button is an internal rotation position. So the first exercise we're going to show is called our sleeper stretch. We're going to do it up here against the wall. I'm going to have Ashley take her elbow up to shoulder height. She's going to let that hand fall toward her belly button, so we're rotating inward. If she can tolerate it, she can add a little overpressure with her other hand. That is an internal rotation sleeper stretch. So again, any internal rotation is moving palm toward the center of your body. Now, her left side is her surgical side. I'm going to show another internal rotation stretch. So for this, I'm going to have Ashley turn her back to the camera. I'm going to give her a towel, and we're going to use that towel to work on internal rotation of her left arm. So what that's going to look like again is she's bringing that hand toward the center of her body. This can be a great way to do it if you've got good range of motion in that right shoulder. But if for some reason someone has difficulty with right shoulder range of motion as well, another position could be to leave the left hand here, reach around the front. And now she can reach that right arm up in order to create that internal rotation. So again, internal rotation is any time we are stretching inward into that body. So that's your sleeper stretch and your towel internal rotation stretch for post-surgical shoulders. If you have any questions, you can reach out to the folks at Alpine Orthopedics.
So now we're going through some external rotation motions, and Melissa, our PT, is going to help guide us through those.
All right, so external rotation is anytime you're bringing your hand away from the center of your body. After a shoulder surgery, we focus both on external and internal rotation. Anytime you're doing internal, you're coming in. Anytime you're going external, you're going out. So with these exercises, you want to make sure you're remembering your hand should be going away from your body. We're all about positivity, so you're always going to be in a thumbs up position. Thumbs up is really important for keeping your shoulders safe during these exercises. So if you have a ski pole, a broomstick, a PVC pipe, or anything similar to this at home, this is going to be your high-tech piece of equipment to be successful with this exercise. What I'm going to have Ashley do is she's going to hold this ski pole with her thumb up, her left side is her surgical side, and we're going to use her right hand to externally rotate, almost like she's swinging open a door, this surgical shoulder. That's the stretch. You're using a ski pole, a PVC pipe, or something like that in order to do all the work with your non-surgical side. The goal here is working on that external rotation, hand away from the body. If you think about the movement you would do to throw a ball for a dog or something like that, that's your external rotation. Couple fine-tuning points here. You always want to be thumbs up when you're holding on to the ski pole. That just puts your wrist in neutral and keeps your rotator cuff safe. We also want your elbow as close to your torso as possible. So if I slide her in a little bit, what you'll see when she does the exercise is now she won't quite have as much range of motion. Patients like to get more range of motion, so a lot of times we'll see people whose elbows are out this far, because then they can just go forever. But the goal is elbow nice and tight against the torso, gentle pressure with the non-surgical side, thumbs up right here. All right, that's your external rotation stretch.
We're going over some important exercises after your shoulder surgery. So Melissa, our PT, is going to take us through some shoulder flexion exercises right now.
Shoulder flexion is key after shoulder surgery because you want to be able to wave down an Uber or raise your hand to ask a question. In order to work on that and have some good homework you can do outside the clinic, what we recommend is taking a towel. You're going to tuck your hand inside that towel and slide on up here in the doorway. As you can see, what that does is it creates shoulder flexion, allowing that arm to come up and create a nice big open angle with her rib cage. We're going to bring that elbow all the way down to her hip. You want to come all the way down into that position and then go ahead and slide back up, making sure that you're not pushing into any sort of discomfort or pain, breathing while you're doing this exercise, and just kind of being relaxed and letting the shoulder do its work. So this is a great sliding exercise. We can also use the doorway in order to do a more sustained range of motion. So I'm going to have Ashley put her fingertips up at that doorway, and then she's going to step through the doorway. You can see she's actually getting into a greater shoulder flexion angle here. Again, a few deep breaths while you're in that position, just trying to be nice and relaxed. This is a great way to help out your physical therapist with the work they're doing when you're at the clinic.
So now we're going to go through some external rotation exercises, and our physical therapist, Melissa, is going to walk us through.
So after shoulder surgery, we have two types of rotation we're trying to restore: internal rotation and external rotation. Internal is hand going toward the midline or towards your belly button. External rotation is the motion you would use to throw a tennis ball for a dog or participate in most sports. So when we're coming toward the center of the body, that's internal. When we're coming away from the center of the body, that's external. So this stretch is an external rotation stretch. We're going to have Ashley bring her elbow up to shoulder height, so she's at a nice 90-degree angle right here. And then what she's going to do is she's going to gently step through the doorway and turn her torso towards me, which is creating that external rotation stretch. As well as with other stretches, the goal here is to relax, take some deep breaths, just stay in that position and let the tissue stretch. We recommend that you do this as often as your physical therapist tells you, which is probably most days. This is a type of homework you can do to help your physical therapy and recovery go more smoothly. So if you have questions, go ahead and reach out to us at Alpine Orthopedics.